help a little? Okay, all right, so that's just that. Now, you see on page 9. On page 9, you have labs. Now, make sure you write it down. First of all, what category is this page? Reduction of risk. Your labs fall right in here. You know, the one you keep messing up. So what I need you to write on top of this page, because it's a big hairy deal, it's a big change. Nclex will give you lab normals. Write it down. Nclex will give you lab normals. They'll give you the normals. So don't sweat that. The problem is once they tell you that they're going to give you the normals, you guys say, well, fuck the labs then. Wrong answer. You still must understand the labs. So what I did is I have this page in here so that you understand it. So if you look at magnesium and you see they give you the normal so you don't have to get all out of control about it, I still gave you some tips that you must understand. So look what I wrote. I wrote under number 1, calcium equals magnesium. When you see me write something like that, it means that if your calcium is low, your magnesium is low. If your magnesium is high, your calcium is high, okay? Now, then I wrote something else to help you know who might be in trouble with magnesium. Who's the person that might get in trouble with magnesium? What did I write? What did I write next to what's ETOH? Low with alcoholics. ETOH is the chemical name for alcohol. That's the chemical name. In other words, beloved, your calcium and your magnesium are very low with alcoholics. Do you see that? Okay, then I wrote something else that is on that damn test. What did I write about a low mag? Torsades. Do me a favor, because almost 99.99.99.99% of you don't know what that is. So do me a favor, write tornado. And I'm going to come around and show you what it looked like so you never forget. Because one of y'all tried to save somebody's life at work after I showed you this and the damn nurse didn't listen. So, when it comes to torsades, it looks like an EKG with a tornado that stops and starts back and stops and starts back. And you will see that when I come around. Yep. See the spinning tornado? See the breaks in between? Torsades is a tornado.
And this is in patients
With low mag. And that's the alcoholic. This is the alcoholic strip right here. And the patient that she tried to save when she came out of class after I showed that to her, he coded and died in radiology during a scan because the nurse didn't understand what she was looking at. She tried to tell her, this is an emergency EKG. This EKG don't look right. This is what my teacher showed me in class. She just forgot the name of it. She didn't remember the name. So tornado, torsades. Tornado, torsades. This is a low mag. That's all this is. That's all it is from. It's a low mag that causes strip. And it's generally speaking your alcoholics. Okay, so that's like important. Tornado, torsades. Okay, beloved. Number 2 is phosphorus. And again, you don't know anything about phosphorus. I fucking didn't know anything about phosphorus. So what I did is I gave you what you gotta know, not the shit you don't need to know. So if you look at what you gotta know, what does it say? CKD AKI. Help me out. What does that mean? Chronic kidney disease, which takes 15 to 20 years. And then what's AKI? Acute kidney injury. So whether or not your kidneys want to be on vacation because you was doing too much for the last 20 years, or they want to suddenly go out and say, fuck you in one day. That's basically the difference. 20 years versus one day. Whether or not either one of those is true, your phosphorus will be high. You see that? And what's going to be low if it's the opposite of calcium? Phosphorus will be high. What will be low? Calcium will be low. They are opposites. Understand the relationship. So if I tell you, watch this. Well, let me ask it first. I'm going right here up your backyard and through your parking lot right here. Let's see who know it. What part of your body controls calcium phosphorus balance? I'm coming down your street. If you don't know, just say, I don't know, Chad. Bone, you said? Oh, that's a good guess. Kidney? You don't know? You're allowed to say, I don't know. It's rare. You think it's thyroid? Oh, I can stop now. Miss Catherine guessed it correctly.
That's right.
Go on, girl. Do your thing. Watch my fingers. The tips of all 4 of my fingers are the size of your parathyroids on the side of your thyroid. They control calcium and phosphorus balance. When you have a thyroidectomy, they may have pulled some parathyroids with it and caused your calcium to be low and your phosphorus to be high. Okay, they're opposites. They are opposites. Okay, good job. Okay, beloved, if you look, number 3, you don't care because that's an and sign. But potassium, I find that you get confused sometimes about potassium. Everyone here is very intelligent. You know potassium got to stay 3.5, 5.3. Just flip the number backwards and you'll get the other range. But then you got to know what all body parts have to do with it. Right, guys? You know that everybody with a funky potassium needs an EKG. Agree? We know, however, that maybe some students are not aware of what the GI system will do with potassium. So let's figure it out. If I have a high potassium, what will this GI system do? What will the GI system do? What will I show up doing in the GI department? What will my body do if my potassium's high? Will I do nothing or will I do something? High. What does potassium control?
Your heart.
Heart and muscles.
A muscle spasm.
So let's go with that. If potassium controls muscles and heart, and I am talking about the muscles in my GI system, and the K is high, what will I have? Diarrhea. If the potassium is low, what will I have? Bowel obstruction. So when you get a patient who just had surgery and they have no bowel sounds, if it's within 6 hours, we're not worried. But if it's after 6 hours and they still have no bowel sounds, they probably have a low K and they're getting into trouble with the paralytic ileus or bowel obstruction. That's very common post-op, extremely common. So low K is bowel obstruction or paralytic ileus, high K is diarrhea. And then if you look a little bit further on this little list here, it talks about the kidneys. So let's go there. Potassium does not control the kidneys, but potassium can kill the kidneys. However, the kidneys are involved in doing what with potassium? What do the kidneys do with potassium? Excrete it, right? So every time you go across the hall or downstairs to the student bathrooms and you pee out potassium. Is that fair? But what if your kidneys have failed? They can't get rid of potassium. And that's why kidney failure patients have a high K. One of the primary reasons why we send you to dialysis every Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday is to get the K off of you before it kills you, right? So when people miss a dialysis appointment, which they do, by the way, they blow it off all the time. One of those times can kill you, and it did kill my cousin. He missed 1 day only. He's dead. Keep fucking with dialysis if you want to. One of them days gonna get you. Okay, so encourage your crazy patients, because they out here. They gotta go to dialysis. Okay. All right. Now, if we look at number 5 on page 9, calcium. Oh, I promise you, I give you my word. I sign off on the Bible that this is on your test. Those 3 words, tetany, Chavostics, and Trousseau's, are all over your test. What do they mean? Low or high?
It's
Low. Very nice. And I'm on number 5.
But they changed the words now. So they'll say like arm jerk or sorry.
Well, they want to see if you know what this means, right? So if they say tetany, then that word jumps out at you. But if they say pharyngeal spasms, they lose you because you didn't have a grip on physiological adaptation. You didn't know that by definition, tetany is pharyngeal spasms. So it's not enough to memorize. That's why the tests kick you in your ass if you go in there talking about you memorize some mnemonics. Good luck with that bullshit. It doesn't work. You have to understand the concepts, right? So if you say Chavostics, oh, you're going to be all right. But will you still be all right if they say the patient's mouth and face is twitching? Will you still be okay? Will you? I hope so. If you really know it, you will. They may say Trousseau's, or they could say when the nurse took the patient's blood pressure, the patient's fingers and thumbs started spasming and got stuck. Do you understand? I said the same thing. And then they show you that picture. Okay? So don't worry your Jerry curl, the pictures and so many of these packets. You'll be fine. But I'm telling you, this shit all over the test. Okay? Now, the seizure is the outcome of all these fancy words. So when a patient has tetany, when a patient has Chavostics, when a patient has a positive Trousseau's, oh yeah, seizure is coming. It's coming. Because everything I just gave you was a warning sign that a seizure is coming. Okay, so that's why that's the outcome. All right. Now, so you can see, and my point, because we do this tomorrow, my point is simply, it's not enough to know normals. You must understand relationships about labs. For example, if you looked at hematocrit and hemoglobin down at the bottom of the page, under number 2, you must understand that a high hematocrit and hemoglobin is dehydration. You have to know that. Okay, so we'll revisit that, but I'm just showing you this packet and why it's a study guide.